We turn now to our health spotlight and welcome in Wish TV medical expert and former U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, you're the first person we wanted to talk to after we heard the announcement about the president. You were working for the White House when President Trump was diagnosed with COVID. I want to get your reaction to when you heard President Biden's announcement.
Well, as you mentioned, President Trump was diagnosed. We've had two presidents in a row diagnosed with COVID. This is a completely different situation because back when President Trump was diagnosed, we didn't have vaccines, we didn't have oral antivirals. And so President Biden is in a much better situation this time around. But it's still jarring when the leader of your country, when the leader of the free world comes down with a virus that could put him in the hospital or worse. That said, as you mentioned, folks aren't surprised because we're seeing spread across the nation. We're seeing hospitalizations start to go up with this new BA4 and BA5 variants. And it's not a matter of if, it's when, which is why we want people to be as protected as possible when they do get exposed.
We've been hearing that for months and months now, right? It's not a matter of if, it's just a matter of when. When it comes to President Biden, are there any extra concerns because of the president's age and baseline health?
Well, absolutely. And this is one of the keys here. We want people who are older, people who have risk factors for progression to severe disease, such as obesity, such as high blood pressure, such as a history of smoking or heart disease or diabetes, to know that getting a booster significantly increases your chances that you'll be able to stay out of the hospital, that you'll have a mild case of COVID if and when you do get COVID. Yet only about a third of people across the country, even lower rates than that in Indiana, have gotten their booster shot or are up to date by the CDC's definition. But to President Biden's point, like you said, age and heart conditions, he is at higher risk, and that's why he's double vaccinated, double boosted.
Dr. Adams, talk to us about Paxlovid, the drug that the president's taking.
Paxlovid is an oral antiviral. It's been shown in studies to lower your chances of being hospitalized or dying by 88.9%. It's a drug combination that you take twice a day for 5 days. And I've said frequently that it's not being prescribed enough. Number one, because people aren't getting tested when they do have symptoms, and they aren't being prescribed this medication. But with an almost 90% decrease in your chance of being hospitalized or dying, what people should take from this is that if you get diagnosed with COVID, you should talk to your doctor. You should ask about Paxlovid. It can also lower your chances in many people's minds of developing long COVID symptoms. We don't have great evidence for that right now, but it lowers viral load. And so with 1 in 5 people, even with mild cases of COVID, developing long COVID symptoms, brain fog, and a higher chance of diabetes or cardiac issues, it's certainly a drug that more people should know about.
We have a couple of other stories in the health world that have been getting our attention. I want to get your reaction to New York reporting their first U.S. case of polio in a decade. How significant is this?
Well, it shows you that vaccine hesitancy was an issue prior to COVID. It got worse during COVID, and we're going to continue to see a struggle. This is a strain of polio that actually only arises in communities where you have low levels of vaccination rates against COVID. And I'll point out the community in New York where this polio case occurred is the same community where we had measles outbreaks back in 2019. So unfortunately, not surprised, but it shows you that we've got some work to do, not just with COVID vaccinations, but with measles vaccinations, polio vaccinations, and beyond. And if we don't, we're going to continue to see a resurgence and a worsening of these vaccine-preventable diseases.
You know, we have seen a jump in monkeypox cases in Indiana, 26 now, according to the CDC. You know, you've been really vocal about current messaging. What do people need to know about who is at risk?
Well, right now, over 99% of the cases that have been diagnosed in men, primarily in men who are having sex with men. That's different than the epidemiology previously of monkeypox, which is spread by close personal contact and has mostly been spread by household contact. So we need to direct education, testing resources, vaccinations to those communities, the communities of men who have sex with men. But we also need to be aware that this is just the tip of the iceberg. We're going to see more cases. We're seeing more cases in women. We're seeing cases in children now. And so people need to be aware of what's going on. If they have a suspicious lesion, they should talk to their doctor and determine whether or not they need to get vaccinated, because you can be vaccinated after exposure to prevent progression of disease. But for men who have sex with men, that's where we need to focus the majority of our attention right now, while not turning a blind eye to what is sure to be future spread in other communities.
Dr. Adams, thank you so much for spending some time with us. There's always so many things to talk with you about. Until next time.
Always great to talk to you.